And as we've been mentioning, today is World Diabetes Day, and the Institute for Spirituality and Health at the Texas Medical Center is working to improve access to diabetes prevention here in the greater Houston area. Joining me now is Marisela Caceres, Program Manager for the Houston chapter of Cities of Changing Diabetes, and Serena Valentine, Executive Director of the CORE Initiative. So tell me a little bit about your organization and, how the Institute for Spirituality and Health and Cities Changing Diabetes, what are these two things all about?
Well, the Institute for Spirituality and Health is the backbone organization for Cities Changing Diabetes Houston. They got together with other agencies, other organizations, community leaders to plan and implement Cities Changing Diabetes here in Houston.
Why is this so important for Houstonians to have? Go ahead.
This is very important because the number of diabetes diagnoses is rising exponentially, and
when you say that, you mean type 2 diabetes.
Type 2 diabetes. And it is very important for people here in Houston to have resources available because there are a lot of resources here that people do not know about. And they need to be informed.
What would some of the things be? Like, what would if somebody's watching right now and they want to be able, they need help with the diabetes management or getting tested or something like that, like what can you offer them?
Well, one of the things that we can offer, we have a diabetes platform. It's specifically for people living with diabetes, pre-diabetes, or anybody that really would like to know more about diabetes. This is a platform that is online, is free. You can get referral to different services related with diabetes, diabetes education programs, anything related with community resources.
And so somebody right now who's watching us through our, online streaming, they can just go to where online to find more information?
They can go to mydiabeteshq.org, and if they need information, they can send us an email at info.mydiabeteshq.com.
What would be the importance of somebody getting help to manage diabetes or getting a diagnosis of diabetes? A lot of people think that they've got it under control or they can just do it by themselves. What would be the importance of getting help?
The importance would be that a lot of times when you're living with diabetes, or even if you don't know you have it, there are things going on inside your body that you can't feel. So getting a proper medical home, getting the education on how to manage, and getting that support that you need can greatly help your outcomes while living with diabetes.
And how do you guys work with the American Diabetes Association to help people here in Houston?
Well, the way how we work, they were part of the core team when diabetes, Cities Changing Diabetes came here to Houston, so they were in the planning phase of Cities Changing Diabetes Houston, and they continue to implement and help us to facilitate all the services in the community. So one of the campaigns that they are trying to do right now is pre-diabetes screening. So that's very important to get tested and make sure if you are at risk. One of the ways is having a screening to see if you have pre-diabetes or not.
And why is that so important?
It's super important because around 80% of the population does not know that they have pre-diabetes. So it's very important so that way they can prevent to be ending diabetic type 2.
Yeah, because like we were just talking about during our 6 a.m. broadcast, this leads to kidney damage, heart damage, nerve damage, blindness. Like you were saying, things are going on inside of your body that you can't feel until it's too late, until the damage has been done.
That's right, exactly. So it's important to do early detection, and then once if that the case you are pre-diabetic, you need to have treatment as well, follow-up management to prevent ending with diabetes type 2.
But so many people have this misunderstanding that it's as simple as, okay, well, I'll just control it with my diet, or I just won't eat sugar. Go ahead. It's not that simple, right?
It's not that simple. A lot of people think that even if you just take your medications, I take my medications, I'm okay. That's not true. Diabetes is excess of glucose in the blood. So it matters what you're putting in, what you're eating. It matters how that glucose is properly metabolized in your body, how you get it out by exercise, using it up by energy, because glucose is energy in the body. So all of those things have to come together. And there are other factors that are not often talked about at the doctor's office that can affect your blood sugar levels. So education is very important.
Yeah, absolutely. And we've talked a lot about type 2 diabetes during this interview. Do you guys work with type 1 patients as well?
Yes.
You do?
Yes.
Okay. What would you like type 1 patients to know about your resources that you have available?
There is support. A lot of people dealing with type 1 have been dealing with that since they were children, and it may even feel like they're alone and no one really understands what they're dealing with. And so the peer support program under Cities Changing Diabetes that I'm project lead for, we help people to understand you're not alone, and there is support for you. There is support, and we help people navigate through everything: stress management, sleep, all of that stuff. So we're here to support as well.
Yeah, well, I'm glad you have that available for them, and support is so important, and sometimes it's hard to find that. So thank you guys for bringing this issue to light, and we will link to your organization on our website, click2houston.com. Marisela Caceres and Serena Valentine, thank you so much for coming in this morning.
Thanks for having us.
Thank you.